test is positive, it means that the person has been infected in the past. And what do we expect from these serosurveys? We expect to see the percentage in the general population, who is at a higher risk of getting infection, which are the areas which need more contained efforts, which need to be strengthened. And the objective is to provide scientific guidance from time to time, and that is the purpose of this one of the very early surveys that we have done, and multiple surveys will be done as we go on to guide. And similarly, we have been providing the scientific evidence either through the National Task Force or the Joint Monitoring Group to the government, which is the National Task Force chairman is Dr. Vinod Paul, and the Joint Monitoring Group is chairman of the DGHS, and we've been providing scientific evidence. So now let's come to this serosurvey. So this was the first serosurvey conducted in May in collaboration with the state health departments, in collaboration with the NCDC and the WHO. And basically it had two parts. The first part was to estimate a fraction of population to be infected with SARS-CoV in the general population, and that is the part that is completed at the moment. And the second part is to look at the prevalence of this SARS-CoV-2 infection in containment zones in hotspot cities, and that is ongoing as we speak. Now the data was collected, as I mentioned. We took it a written informed consent and ethics clearance, and 3 to 5 ml of venous blood was taken, and then this sera was evaluated for the IgA antibodies by the ELISA test, and this ELISA test is also being made available to the states to carry out serosurvey in different groups of individuals within their states. Now in this, the part one of the survey, which is complete, we had was a population-based serosurvey in which several districts were studied and divided into 4 groups, and in each group, whether it is 0 prevalence by RT-PCR or 0 to 5 or 5 to 10 or more than 10% per million cases in different districts, were divided into 4 groups, and 15 districts were in each group, and 400 individuals were studied from each district. And then from each village or urban area, we selected 10 villages and 40 adults, and every household one adult was studied. So we actually studied about 83 districts in the country, and number of households that were visited were 28,595, and we were able to collect the blood samples and the data from 26,400 individuals. The results were that we found that about 0.73% of the population in these districts showed a prevalence of past exposure to SARS-CoV-2 infection. This means that the lockdown and the containment measures have been successful in keeping it low and preventing rapid spread of this disease over the last 3 months as we speak. However, it means that a large proportion of the population is still susceptible. And which were the individuals which were higher at risk? Risks was slightly higher in urban areas, 1.09 compared to 1, and it was higher in urban slums, nearly 1.89 times higher than rural areas. But the good news is that the infection fatality rate was very low. It was 0.08% as far as this 26,000 individuals was looking at the population. The infection in the containment zone was found to be high and variable, and this is still ongoing, and this data is still being looked at. So in conclusion, I would like to say, since a large proportion of our population is still vulnerable and susceptible to infection, we have to work on the non-pharmacological interventions such as physical distancing, use of face mask, hand hygiene, cough etiquette, and urban slums are are highly vulnerable for the spread of infection, and the local lockdown measures need to continue as advised by the Government of India, particularly in those containment areas, and they have been successful up till now in containing them. And the high-risk groups of our population, that is the elderly, people with chronic morbidities, pregnant women, children below the age of 10 years, they need to be particularly protected, and efforts to limit the scale and spread of the disease will have to be continued by strong implementation of containment strategies by all the states. And the states cannot, and I emphasize here, the states cannot lower their guard and need to keep on implementing effective surveillance and containment strategies for preventing the spread of this disease. So I will stop here, and I'd request Professor Vinod Paul to give his wisdom.
Thank you, Professor Bhargav. You can have the last slide on, conclusion slide if possible. So आज एक